Everyone, this is a video that I did not expect to be making today, but as you can see from the title, abrupt end to my r3Tatouille trial. So if this is the first time you're stumbling across me, my social media handle is Mimi in Oz. I've been on a r3Tatouille clinical trial for the last 20 months. So that is the name that we cannot mention, but it's the medication that has a triple agonist, GLP, GIP and glucagon. And in the time that I've been on the trial, I've lost over 36% of my body weight, come off my blood pressure medications completely, reduced my cholesterol and thyroid medications. My BMI has dropped from 36 to 22. So today I went in to have my routine 88-week clinical trial visit. My trial was supposed to be 104 weeks long or 2 years long. When I arrived for my usual visit today, they told me that the manufacturers have decided to cut the trial short. And they've cut it back to 80 weeks. So anybody who was at 80 weeks or beyond was going to be immediately cut off with no more supply of medication. And that I needed to have a large visit today. So have lots of blood tests done, lots of urine tests, blood pressure measurements, weight, do lots of surveys, EKGs, all those sorts of things. And then I cannot have any type of weight loss medication at all for the next month. And then I have to come back for one final visit and have all of those blood tests and things done again. And then that's it. So I'm very shocked. It was not the visit that I was expecting. You know, I knew the trial was coming to an end in February, but I had kind of banked on that happening. I did check with the trial site and said, look, are they stopping it because there's something, they've found an issue? And they said, no, they've just found that they've already got enough information and they don't need to collect any further information as part of this trial. So this is just my trial, which is the cardiovascular arm. It's not all of the r3Tatouille clinical trials. I guess, so for the next month, I will not be on any type of medication at all. I had my last shot on Saturday and I guess I will wait and see how it pans out. I'll be honest with you, I'm scared. I'm scared about the inflammation returning. I'm scared about the food noise returning. I'm scared about the loss of control, but I'm trying to be positive and I'm trying to remember that I can do hard things. I've done hard things before and I can do hard things again. But the endocrinologist as part of the trial is actually writing a letter to my local doctor today to say that she would recommend that I go on a low dose as maintenance once my 1 month washout period is done. So I guess I do have something to go on for long-term maintenance, but I am very shocked. I'm glad that the trial's being ended for a good reason and not a bad reason. You know, it will be, if they can get this out to market sooner for people, then the sooner it can start helping other people as well. But yeah, that is my abrupt end to my r3Tatouille clinical trial. So I'll keep posting and I'll let you know how the month goes off the trial drug and how starting up again with low dose sema goes and my long-term health journey. If you have any questions, please feel free to drop them in the chat. Might not be able to answer them, but I will try. And otherwise, I wish you all a great day. Thanks so much. Bye.